9 cases, 5 deaths. Louisiana, 2026. 9 people were infected with a bacteria you've probably never heard of this year in Louisiana. 5 of them are dead. That's not a bad flu season. That's a kill rate over 50% in a state that used to see just 1 death like this a year. And here's the part nobody's telling you. The federal government made it harder to track this bacteria a year before the bodies started piling up. This isn't a horror movie. This is a budget line item. What happened? Local Louisiana news anchor covering the warning. On August 6, 2026, the Louisiana Department of Health issued a public warning about Vibrio vulnificus, a naturally occurring bacterium nicknamed flesh-eating bacteria, because in its worst cases, it triggers necrotizing fasciitis, where the tissue around a wound literally dies. Here are the numbers. 9 confirmed cases in Louisiana so far this year. All 9 were hospitalized. 5 died. Every single case was linked to a wound that touched seawater, not seafood, wounds. And every patient had an underlying health condition, like liver disease, diabetes, or a weakened immune system. 10-year average, 7 cases, 1 death. 2026 so far, 9 cases, 5 deaths. For context, Louisiana's own 10-year average for this same stretch of the year is 7 cases and 1 death. This year already has 5 deaths, 5 times the historical norm, and beach season isn't even over. This isn't isolated to Louisiana, either. Florida has logged 2 deaths of its own in 2026. Mississippi issued its own warning back in June. Flesh-eating bacteria kills 5 in Louisiana as cases outpace 10-year average. The backstory: Vibrio vulnificus isn't new. It's been quietly living in warm coastal and brackish water for as long as there's been warm coastal water. River mouths, estuaries, the mix of fresh and salt water along the Gulf Coast. It thrives when water temperatures climb, which is why cases cluster between May and October. You can get it 2 ways: eating raw or undercooked shellfish, especially oysters, or exposing an open wound, even a small cut or scrape, to seawater. About 1 in 5 people who get infected die, according to the CDC, sometimes within a day or 2 of symptoms starting. Survivors can lose limbs. Rising Gulf Coast sea surface temperatures over the past decade. Here's the trend line that matters. This bacterium's range is expanding. Researchers found it this spring in water samples off Long Island, New York, a place that historically was too cold for it. Marine scientists studying the Gulf and Atlantic coasts point to warming ocean temperatures as the reason it's showing up in new places and in bigger numbers. Florida's worst years on record: 19 deaths in 2024, 17 in 2022. Both followed major hurricanes, which pushed contaminated floodwater and storm surge into places people don't expect to encounter it. But 2026 is different. Neither Louisiana nor Florida has been hit by a major hurricane this year. This outbreak is happening during a completely ordinary summer. That's the detail infectious disease specialists keep flagging. This isn't a freak disaster response. This is what a normal Gulf Coast summer looks like now. Louisiana Department of Health press release, August 6, 2026. The state's message is straightforward and, frankly, responsible. If you have an open wound, stay out of coastal or brackish water, or cover it completely with a waterproof bandage. If a wound touches seawater and starts turning red, swollen, warm, or discolored, get medical care immediately and tell your doctor about the water exposure. Cook seafood, especially oysters, thoroughly. HHS spokesperson response. At the federal level, the message has been reassurance. When reporters and health researchers raised concerns earlier this summer about reduced federal tracking of Vibrio and other foodborne pathogens, a Department of Health and Human Services spokesperson defended the agency's overall direction, without disputing the specific facts of the cuts. The official federal line: the CDC still monitors these pathogens through other national surveillance systems, and reporting changes don't put Americans at greater risk. So, the bacteria is natural, the climate is warming. Wear a bandage, don't panic. The system's got it covered. That's the official story. Let's check the receipts. CDC FoodNet Program Overview. Since 1995, the CDC has run a program called FoodNet, the Foodborne Diseases Active Surveillance Network, working with 10 state health departments to track illness from 8 major pathogens, including Vibrio. It's the backbone of how the U.S. spots foodborne and waterborne outbreaks before they spiral out of control. CDC slashes FoodNet surveillance from 8 foodborne pathogens to 2. As of July 2025, that changed. HHS made reporting mandatory for only 2 of the 8 pathogens, Salmonella and E. coli. The other 6, including Vibrio, Listeria, Campylobacter, and Shigella, became optional. States no longer have to report those cases to the CDC at all. CDC internal talking points, obtained by NBC News. Internal CDC talking points, obtained by NBC News, gave the reason plainly. Funding hadn't kept pace with the cost of running full surveillance across all 8 pathogens. CDC estimate: approximately 80,000 Vibrio infections per year nationwide. This isn't a small program tracking a rare curiosity. The CDC's own estimate puts total Vibrio infections at roughly 80,000 a year nationwide, with the most dangerous species, VULNIFICUS, steadily rising. Over the past 5 years, national data shows more than 400 wound-related cases and more than 130 foodborne cases from this species alone. FY 2026 HHS budget. The fiscal year 2026 federal budget goes further, eliminating funding entirely from the Prevention and Public Health Fund, the pot of money that supports exactly this kind of disease prevention infrastructure. Reaction from the people who actually do this work has been blunt. Barbara Kowalczyk, who directs a food safety institute at George Washington University, pointed to years of federal funding not keeping pace with inflation as the real driver behind states struggling to maintain surveillance. Bill Marler, a food safety attorney who spent decades litigating these exact cases, put it in plainer terms. Since 1995, the CDC has run a program called FoodNet, the funding not keeping pace with inflation as the real driver behind states struggling to maintain surveillance. Bill Marler, a food safety attorney who spent decades litigating these exact cases, put it in plainer terms. The response wasn't uniform. Maryland told reporters it would keep reporting on all 8 pathogens, regardless of the new federal rules. Colorado said it would likely have to scale back if funding dropped further. That's the system now, a patchwork, where whether your state tracks a potentially deadly bacterium depends on that state's own budget choices, not a national baseline. See no Vibrio, hear no Vibrio. Here's what doesn't add up. The federal talking point is that other surveillance systems still catch these pathogens, so the public isn't at greater risk. But the entire point of mandatory reporting through FoodNet was consistency, a guaranteed national baseline, so outbreaks in one state get compared apples to apples with outbreaks in another. Making that reporting optional doesn't preserve the system. It just means the picture we get depends on which states feel like sending in the paperwork. Reporting status for Vibrio, now optional, as of July 2025, and the timing is hard to ignore. Federal reporting requirements for Vibrio were loosened roughly a year before Louisiana logged 5 times its normal death toll from the same bacterium. Correlation isn't causation. Louisiana's outbreak is also tied to warming water, and its cases were traced through the state's own health department, not through FoodNet directly. But the broader argument the administration made, that trimming this program wouldn't leave the country flying blind, is being tested in real time, in real hospitals, right now. There's also a smaller, telling detail. HHS reportedly reversed a separate plan to dismantle an ocean monitoring system after bipartisan pushback in Congress, but left the Vibrio surveillance cuts in place. That's not the profile of an agency confidently standing behind every cut on principle. That's an agency that backs off when the political cost gets high enough and doesn't when it doesn't. HHS spokesperson non-denial. Nobody in this story is claiming the cuts caused the deaths. Nobody credible is even trying to make that claim. The contradiction is narrower and more damning than that. The government told you less tracking wouldn't mean less safety, and then delivered a summer that looks exactly like what you'd expect if tracking mattered. 1 in 5 Vibrio vulnificus infections are fatal. This isn't an abstract policy fight about line items in a federal budget PDF. If you fish, swim, wade, boat, or shuck oysters anywhere along the Gulf Coast, the Atlantic seaboard, or increasingly Long Island Sound, this bacterium is now part of your risk calculus in a way it wasn't 5 years ago. The people most exposed aren't abstract statistics, either. Every documented case in Louisiana this year involved someone with an underlying health condition. People managing diabetes, liver disease, cancer, or immune suppression. These are ordinary Americans doing ordinary summer things. Fishing with a bandaged hand, wading in after a boat ride, walking a beach with a healing scrape. The system that's supposed to flag rising risk in their area faster is the same system that just got told reporting is optional. And there's a wealth angle hiding in plain sight here, too. States with more resources, like Maryland, can afford to keep full reporting going out of their own pocket. States without that cushion can't. So your risk of an undetected outbreak now depends partly on which state you happen to live in, and how healthy that state's budget is, a quiet kind of inequality nobody voted for directly. Timeline of 2025 to 2026 federal public health program cuts. FoodNet, USDA inspection staffing, malaria prevention funding. Vibrio surveillance isn't an isolated cut. It sits inside a broader pattern this year of paring back the government's early warning systems. From the USDA losing a chunk of its workforce right as a livestock parasite reemerged, to a funding freeze disrupting international malaria P. That bet gets tested every summer. A warming ocean pushes a dangerous bacterium further up the coast, and every time a state has to decide, on its own dime, whether it can afford to keep watching for it. This isn't a partisan story about villains twirling mustaches. It's a story about what happens when efficiency and early warning get treated as the same line item, and only one of them survives the budget process. Let's separate what we actually know from what's interpretation. Fact: Louisiana has confirmed 9 Vibrio vulnificus cases and 5 deaths in 2026, well above its 10-year average. Federal reporting requirements for Vibrio and 5 other pathogens were downgraded from mandatory to optional in July 2025, citing funding constraints. Analysis: reduced mandatory reporting likely makes it harder to spot regional trends early and compare data consistently across states, even if it hasn't been proven to cause any specific case or death. Opinion: telling the public a surveillance cut carries no added risk, while simultaneously restoring a different monitoring program after backlash, suggests the decision was shaped more by which cuts were politically survivable than by a clear-eyed judgment about what's actually safe to stop watching. We're the bandage. Watch the budget. The bacteria was always going to be here every summer. The question this year is whether we're still watching for it, or just hoping nobody notices we stopped.